Support is provided in part by ImmunityBio, which is developing next-generation immunotherapies for bladder and lung cancer. ImmunityBio's recently approved Anktiva has demonstrated durable complete response for over 47 months in non-muscle invasive bladder cancer in combination with BCG, with a safety profile consistent with BCG alone. Anktiva can be given for over 3 years as maintenance therapy. Learn more at anktiva.com.
Hello, and welcome to the ASCO Daily News Podcast. I'm Dr. Neeraj Agarwal, your guest host of the ASCO Daily News Podcast today. I'm the director of the Genitourinary Oncology Program, a professor of medicine at the University of Utah Huntsman Cancer Institute, and editor-in-chief of the ASCO Daily News. I'm delighted to be joined by Dr. Jeanny Aragon-Ching, a geomedical oncologist and the clinical program director of GU Cancers at the Inova Schar Cancer Institute in Virginia. Today, we will discuss some key abstracts in geo-oncology that will be presented at the 2024 ASCO Annual Meeting. Our full disclosures are available in the transcript of this episode. Jeanny, it is great to have you on the podcast.
Yeah, thank you so much, Dr. Agarwal. It's a pleasure to be here.
So, Jeanny, let's start with some bladder cancer abstracts. Could you tell us about the abstract 4509 titled Characterization of Complete Responders to Nivolumab plus gemcitabine cisplatin versus gemcitabine cisplatin alone in patients with lymph node-only metastatic urothelial carcinoma from the CheckMate 901 trial?
Of course, Neeraj. So first, I would like to remind our listeners that the CheckMate 901 trial was a randomized open-label phase 3 study where this particular sub-study looked at cisplatin-eligible patients with previously untreated, unresectable, or metastatic urothelial carcinoma, and they were assigned to receive the combination of gemcitabine and cisplatin, followed by up to 2 years of nivolumab or placebo. So based on this data set presented at ESMO 2023 and subsequently published in the New England Journal of Medicine, it now shows significantly improved progression-free survival and overall survival in patients receiving the combination of gemcitabine, cisplatin, and nivolumab. So this regimen was also approved in March 2024 as a first-line therapy for patients with unresectable or metastatic urothelial carcinoma. So in this abstract that will be featured at ASCO this year, Dr. Matt Gulski and colleagues present a post-hoc analysis that aims to characterize a subset of patients with complete response, as well as those with lymph node-only metastatic disease. So in patients receiving the experimental treatment, 21.7% achieved a complete response, while 11.8% of the patients in the control arm achieved a complete response. And amongst these complete responders, around 52% had lymph node-only disease in both arms. So furthermore, when characterizing the subgroup of patients with lymph node-only disease, those receiving the combination of gemcitabine, cisplatin plus nivolumab had a 62% reduction in the risk of progression or death and a 42% reduction in the risk of death compared to those treated with gemcitabine and cisplatin alone. So the median overall survival in the experimental arm in this subgroup was around 46.3 months, while it was only 24.9 months in the control arm. The objective response rates in the patients with lymph node-only disease receiving GemCis plus Nivo was about 81.5% compared to 64.3% in those treated with GemCis alone.
Thank you, Jeanny, for the excellent summary of this abstract. We can say that nivolumab plus gemcitabine cisplatin induced durable disease control and clinically meaningful improvement in overall survival and progression-free survival compared to GemCis alone in patients with lymph node-only metastasis. And I think this deserves to be considered as one of the options in these patients. So let's look at another abstract which is also in first-line metastatic urothelial carcinoma setting, abstract 4502, which reported data on a recently approved combination of enfortumab vedotin and pembrolizumab. So, Jenny, can you tell us more about this abstract?
Absolutely, Neeraj. So, a quick reminder to our audience, this regimen was tested in the EV302 phase 3 trial, where patients with previously untreated locally advanced or metastatic urothelial carcinoma were randomized to receive enfortumab vedotin, I'll just call it EV, plus pembrolizumab or gemcitabine plus either cisplatin or carboplatin, compared to chemotherapy, basically. So this data was also first presented at ESMO 2023 and subsequently published in the New England Journal of Medicine. So they showed that this immune-based combination significantly improve both progression-free survival and overall survival, which were the primary endpoints of the study, compared to chemotherapy. In this abstract, Dr. Shilpa Gupta from the Cleveland Clinic and colleagues present the results of patient-reported outcomes based on quality of life questionnaires in this trial. They found that the time to pain progression and time to confirm deterioration were numerically longer in patients treated with EV and Pembro, and patients with moderate to severe pain at baseline receiving this combination had a meaningful improvement in the brief pain inventory short form worst pain from week 3 to week 26.
Thank you, Jenny. So this means that patients treated with EV plus Pembro did not only have improved survival compared with platinum-based chemotherapy, but also improvement in the quality of life and functioning, which further supports the value of this combination for our patients with locally advanced or metastatic urothelial carcinoma. This is great news for all our patients. So before we wrap up the bladder cancer section, would you like to tell our listeners about abstract 4565, which provides the data on the efficacy of trastuzumab deruxtecan in patients with bladder cancer?
Yes, absolutely, Neeraj. And this is very timely given the recent FDA approval, which we will talk about in a minute. So this abstract is entitled Efficacy and Safety of Trastuzumab deruxtecan in Patients with HER2-Expressing Solid Tumors. Results from the bladder cohort of the Destiny Pan-Tumor 02 study. And as a quick reminder, the Destiny Pan-Tumor 02 was a phase 2 open-label study where trastuzumab deruxtecan, which is an antibody-drug conjugate targeting HER2 expressed on cancer cells, was evaluated in patients with HER2-expressing locally advanced or metastatic disease who previously received systemic treatment or who had no other treatment options. So the expression of HER2 was evaluated on immunohistochemistry by local or central testing. The primary endpoint was confirmed objective response rate by investigator assessment. Secondary endpoints also included duration of response, progression-free survival, disease control rate, and safety. The primary analysis, which was published in the Journal of Clinical Oncology, showed an objective response rate of 37.1% and responses across all cohorts. And the median duration of response was 11.3 months. So based on these results, the trastuzumab deruxtecan was just granted accelerated FDA approval for unresectable or metastatic HER2 positive IHC3 plus solid tumors, and that was just recently in April 2024. So back to this abstract in particular, Dr. Wysocki and colleagues report the results of the bladder cancer cohort specifically. So the study included 41 patients with urothelial cancer, and at a median follow-up of around 12.6 months, the objective response rate among these patients was 39%. And the median PFS was 7 months, and the duration of response median was 8.7 months. And the disease control rate at 12 weeks was around 71%. And regarding the safety profile, about 41.5% of patients exhibited grade 3 or more drug-related adverse events. and interstitial lung disease or pneumonitis did occur in about 4 patients. Although there was no statistical comparison between the different groups, the objective response rate was numerically highest among the HER2 3+ group with 56.3%.
Thank you, Jeannie. So these data support consideration of trastuzumab deruxtecan as a salvage therapy option for pre-treated patients with HER2-expressing urothelial cancers and show that we are extending our treatment options to include therapies with novel mechanism of action. This is definitely exciting news for our patients with bladder cancer.
Yeah, absolutely, Neeraj, and I concur with your thoughts. Now let's switch gears a bit to prostate cancer. So could you tell us a little bit more about abstract 5005, which is entitled Embark Post-Hoc Analysis of Impact of Treatment Suspension on Health Quality of Life?
Of course, I'll be happy to. So enzalutamide was recently granted FDA approval for the treatment of patients with non-metastatic castration-sensitive prostate cancer with biochemical recurrence at high risk of metastasis based on the results of the EMBARK trial. For our viewer recollection, the EMBARK trial was a phase 3 study where patients with high-risk biochemical recurrence were randomized to receive either enzalutamide with leuprolide or enzalutamide monotherapy or placebo plus leuprolide. The primary endpoint was metastasis-free survival, with secondary endpoints including overall survival and safety. So the original results showed that patients receiving enzalutamide alone or enzalutamide plus leuprolide has a significantly improved metastasis-free survival compared to those treated with leuprolide alone while preserving health-related quality of life at a high level. One important aspect in the design of the trial was that patients who achieved undetectable PSA at week 37, they underwent treatment suspension, and the treatment was resumed if PSA increased to more than 2 nanogram per ml for patients who underwent prior surgery or when PSA rose to more than 5 nanogram per ml for those patients who did not undergo prior surgery. So in this ASCO 2024 abstract, Dr. Stephen Friedland and colleagues present a post-hoc analysis of health-related quality of life outcomes after treatment suspension between week 37 and week 205. They found that treatment was suspended in 91% patients receiving enzalutamide plus leuprolide, 86% of those receiving enzalutamide monotherapy, and about 68% of those receiving leuprolide monotherapy. So among those patients who stayed on treatment suspension, a trend towards numerical improvement in health-related quality of life after week 37 was seen in all 3 arms. And this reached clinically meaningful threshold at week 205 in pain questionnaires, in as far as physical well-being is concerned, and as far as urinary and bowel symptoms were concerned. For hormonal treatment side effects, all arms reached clinically meaningful improvement at the subsequent assessment of week 49 to week 97. However, patients slowly deteriorated with clinically meaningful deterioration at week 205 relative to week 37 in patients receiving the combination of enzalutamide and leuprolide and those treated with leuprolide, but not in those treated with enzalutamide monotherapy. Now, concerning sexual activity, a clinically meaningful improvement was reported only in patients receiving enzalutamide plus leuprolide, possibly because sexual function was better preserved prior to suspension in the enzalutamide monotherapy arm, and thus there was less opportunity for improvement while on suspension in those who were receiving enzalutamide monotherapy prior to suspension.
Wow, thank you, Neeraj, for this great summary. So this analysis confirms that treatment suspension in good responders might lead to a clinically meaningful improvement in health-related quality of life. Now, moving on to patients with metastatic castrate-resistant prostate cancer, what can you tell us, Neeraj, about abstract 5008, which is entitled Baseline ctDNA Analysis and Associations with Outcomes in Taxane-Naive Patients with Metastatic CRPC treated with lutetium PSMA 617 versus change of ARPI in PSMA4?
Sure, Jenny. So PSMA4 trial was a phase 3 study that compared the efficacy of lutetium-177 PSMA617 versus an ARPI switch in patients with mCRPC and prior progression on a first ARPI, and patients could not have previously been exposed to docetaxel chemotherapy. The primary endpoint was radiographic PFS, and overall survival was an important secondary endpoint. So the primary analysis presented at the ESMO 2023 meeting showed a significantly prolonged radiographic PFS in patients receiving lutetium. In the abstract that will be featured in the ASCO 2024 Annual Meeting, Dr. Johan de Bono and colleagues present an exploratory analysis regarding the associations between baseline circulating tumor DNA and outcomes. So ctDNA fraction was evaluated in all samples, and they also evaluated the alterations in the ctDNA in key prostate cancer drivers, which were present in more than 10% of participants. The investigators sought to interrogate the association of ctDNA fraction or alterations with radiographic progression-free survival, PSA response, and objective responses at the data cutoff. So the investigators showed that the median rPFS was significantly shorter in patients with a ctDNA fraction of more than 1% compared to those with a fraction of less than 1%, regardless of the treatment arm. Furthermore, ctDNA fraction of more than 1% was also associated with worst objective responses and the PSA responses. Regarding the prostate cancer drivers, those mutations present in the ctDNA, the median rPFS was significantly shorter in patients with alterations in the AR, TP53, or P10 in both treatment arms. There was no significant association between the alterations and the PSA or objective responses.
Yeah, thanks, Neeraj, for this very nice summary. So, in essence, these results show that the presence of a ctDNA fraction of more than 1% or alterations in AR, P53, and P10 were all associated with worse outcomes, regardless of treatment with lutetium or change in the ARPI. So this data definitely is important for counseling and prognostication of our patients in the clinic and may guide the design of future clinical trials. So thank you for this, Neeraj. So let's move on now to kidney cancer. So do you have any updates for us, Neeraj, for kidney cancers?
Yeah, sure. I would like to highlight abstract 4512, which is titled Multi-Institution Analysis of Outcomes with First-Line Therapy in Patients with Metastatic Chromophobe Renal Cell Carcinoma. So here, Dr. Sahil Doshi and colleagues present a retrospective multi-institutional study comparing survival outcomes, including time to treatment failure and overall survival, between various first-line therapy options in patients with metastatic chromophobe renal cell carcinoma where limited clinical trial data exists to guide systemic therapy. So authors categorized patients into 4 treatment groups. And these were patients who were treated with immune checkpoint inhibitors plus targeted therapy doublets, so such as ICI VEGF TKI combination, pure immune checkpoint inhibitor monotherapy or doublets such as ipilimumab plus nivolumab, targeted therapy doublets such as lenvatinib plus everolimus, and targeted monotherapies such as sunitinib. So in this analysis, authors included 99 patients of whom 54 patients received targeted monotherapy with sunitinib, 17 received ICI VEGF TKI combination, 14 received targeted doublets such as lenvatinib with everolimus, and 14 patients received only ICI therapies. So the patients treated with any doublet containing a targeted agent such as ICI VEGF TKI had a 52% decrease in the risk of treatment failure and a 44% decrease in the risk of death compared to those treated with targeted monotherapy like sunitinib. The median time to treatment failure was 15 months with IO targeted doublet, so ICI VEGF TKI, and the median overall survival was 56 months.
Thank you, Neeraj. So these results show that targeted doublet regimens resulted in a longer time to treatment failure and overall survival compared to any monotherapy in patients with chromophobe metastatic RCC, and definitely provides valuable insights on treatment selection, albeit I would say there's still a small number of patients that were included in this retrospective analysis.
I agree. This is a relatively small number of patients, but I decided to highlight the abstract given how rare the cancer is, and it is highly unlikely that we'll see large randomized clinical trials in patients with metastatic chromophobe renal cell carcinoma. So before we wrap up the podcast, what would you like to tell us about Abstract 5009, which is titled A Phase 2 Trial of Pembrolizumab plus Platinum-Based Chemotherapy as First-Line Systemic Therapy in Advanced Penile Cancer, the Hercules or LACOG 0218 trial?
I'm glad you brought this up, Neeraj. And as our listeners would know, advanced penile squamous cell carcinoma has unfortunately a poor prognosis with limited treatment options. So from this perspective, the results of the Latin America Cooperative Group trial 0218 is very important. As you mentioned, this was a phase 2 single-arm study evaluating the addition of pembrolizumab to platinum-based chemotherapy as first-line treatment in patients with metastatic or locally advanced penile squamous cell carcinoma not amenable to curative intent treatment. Patients enrolled received chemotherapy, namely 5-FU with cisplatin or carboplatin, and pembrolizumab 200 milligrams IV every 3 weeks for 6 cycles, followed by pembrolizumab up to 34 cycles. The primary endpoint was confirmed overall response rate by investigator assessment. So in the 33 patients, again, small study, but important one, eligible for the efficacy analysis, the confirmed objective response rate by investigator assessment was 39.4%, and it included 1 CR, complete response, and 12 partial responses. The confirmed objective response rate was 75% in patients with high TMB and 56% in patients positive for HPV-16, making TMB and HPV-16 potential predictive biomarkers for efficacy in this study. Concerning the toxicity profile, any grade treatment-related AEs was reported around 92% of patients, and grade 3 or more treatment-related adverse events occurred in 50% of patients. About 11% of patients discontinued treatment because of adverse events.
Thank you, Jeanny. So I would like to add that Hercules is likely the first trial to demonstrate the efficacy of an immune checkpoint inhibitor plus chemotherapy regimen in advanced penile squamous cell carcinoma with a manageable safety profile. And looks like the combination of ICI with platinum-based chemotherapy is a promising option and warrants further investigation. And before I conclude, I'd like to point out to the fact that pembrolizumab here was used 200 milligram intravenously every 3 weeks and not every 6 weeks, up to 34 cycles.
I agree, Neeraj. Any final remarks before we conclude today's podcast?
Yes, of course. Jeanny, first of all, I really want to thank you for your participation and valuable insights. Your contributions are always appreciated, and I sincerely thank you for taking the time to join us today.
Thank you so much, Neeraj. It's actually a pleasure for me to be here.
So, as we bring this podcast to an end, I would like to acknowledge the significant advances happening in the treatment of patients with genitourinary cancers. During our upcoming 2024 ASCO Annual Meeting, there will be many studies featuring practice-influencing or practice-changing data presented by researchers and physicians from around the globe. I urge our listeners to not only participate in this event to celebrate these achievements, but to also play a role in sharing these cutting-edge data with healthcare professionals worldwide. Through our collective efforts, we can surely optimize the benefits of patients on a global scale. And thank you to our listeners for joining us today. You will find links to the abstracts discussed today on the transcript of this episode. Finally, if you value the insights that you hear on the ASCO Daily News podcast, please take a moment to rate, review, and subscribe wherever you get your podcast. Thank you very much.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.